The discovery of the COVID-19 beta variant in South Africa last year placed the country on the list of no-go destinations around the world. In fact, in the United Kingdom, South Africa was placed on the so-called red list. That meant that UK citizens who traveled into this country had to quarantine for about 10 days at a hotel on their return to the UK. The exorbitant cost of quarantine has slowed down the influx of tourists to South Africa. In 2019, more than 430,000 British tourists traveled to this country, but the Southern African Tourism Association has lobbied British lawmakers and the media to have South Africa removed from that red list. The association has in fact raised 1.5 million rand to pay for this campaign. And as CEO David Frost says, if nothing is done, South Africa could find itself on the dreaded list for years to come. Let's bring in David now. He joins us via our video link from Johannesburg. And David, I imagine top of mind for many people now is this campaign prioritizing public health or reviving the tourism sector?
Oh, good morning, Ayanda. Our campaign is aimed at bringing a data-driven and logical argument to bear to the decision makers in the UK around opening up travel. COVID is a reality. We live with it. At the moment, we are experiencing a third wave in this country. Strangely enough, our infection rate at the moment is almost paralleled by that of the infection rate in the UK. So this is something that is with us. And unless you are able to take a path that New Zealand's taken, where you cut yourself off from the rest of the world, we have to manage it. And the very successful rollout campaign that the UK has embarked upon in terms of their vaccination program, to our mind, puts them in the perfect position to be able to travel. As somebody said, what's the point about being vaccinated if you can't travel? On top of that, we've had domestic tourism open in South Africa since August last year. We have strict protocols in place, and there's been no super spreading that has taken place as a result of domestic tourism. So it's something that we feel can be quite equitably managed, and tourism is an incredibly important sector to our economy. It's often seen through the eyes of the consumer that this is somehow luxury travel and it's a total inconvenience. But we don't see the mirror side of that 1 in 7 South Africans puts food on their table every night because of the tourism industry. So the job creation and the foreign exchange earning capacity of the tourism industry in our country is enormous.
Sure. I want to hone in on this balance between public health outcomes and, I guess, honing in on how we can ensure that the tourism sector doesn't go under. We know the beta variant, which is what is at the center of this red list, at least for South Africa, doesn't necessarily allow the AstraZeneca vaccine to be as efficacious as one would hope. AstraZeneca is used widely in places like the UK. Given that, tell us a bit more about the data that you're using to try push for this.
Well, one of the beauties, of let me just say the sort of unexpected joys about lobbying into a market like the UK is their democracy is quite transparent. So we've engaged with senior politicians across the political divide. So we've spoken to people from the Conservative Party, senior Labour MP on the Transport Committee. We've engaged with a senior Lib Dem peer, and 2 of these individuals have tabled questions in both the Lords and the Commons. And the question that we simply asked is, provide us with the scientific data that you used to determine the beta variant to be a variant of concern. And we got the answer about 10 days ago, because they're given 10 days to respond. And the data that they're using is totally anachronistic. It's out of date. It dates back to December last year. They haven't updated it. And they haven't done the necessary work, we feel, in order to come up with putting us on the red list. We do have a problem in the sense that AstraZeneca is the main vaccine being used in the UK. And we have the beta variant in South Africa, but we need studies that actually match the 2. Now, the beta variant was discovered in certain areas of the UK. We have the postcodes of those areas. And so what we are seeking to do is to work with public to extract the original data from Public Health England and to run a series of analyses of that data in terms of the effectiveness of the AstraZeneca vaccine on the beta variant. But the very axiomatic point is that the beta variant did not spread in the UK. So we have it in South Africa. There was a small spreading into Kenya. Other than that, around the world, it is not as virulent and has not been as prevalent as we have seen the Delta variant be. So that's something we're doing. We're getting, one of the amazing things about embarking on these campaigns is you start drawing in really good people and minds. And we've had amazing support from Discovery in this regard. They have an amazing team. We deal with their top actuary. And we really are trying to bring a data-driven argument to bear. There is a lot of reception to it within the United Kingdom.
Is the beta variant not spreading in the UK testament to the red list working?
No, the beta variant was in the UK, so it doesn't mean once it's seeded and once it's there, it will do its thing in the UK. You either keep it out or you have it. So exactly the same happened with the Delta variant. The Delta variant came into the UK, but that has spread quite prolifically in the UK, whereas the beta variant hasn't. So we need to have a look at this. But the point, Ayanda, is that there is always risk inherent in any form of travel. As somebody said, that's why you have a safety briefing when you get on an aeroplane. But in this world that we live in, we are seeing a far more pragmatic approach from other countries. So the US, for example, is allowing their citizens who have been vaccinated to travel. And they do the COVID testing prior to departure. We still require that in South Africa. But if you are vaccinated and you test negative, you can return to your country without having to go through the onerous 10-day quarantine rigmarole. And that's what we are asking to be removed in the short term.
Yeah, to South Africans watching us, the concept of lobbying might feel like a far distant one. We don't often speak about that. Help us understand the strategy from your end and whether or not something like that works. In other words, do lawmakers in the UK actually care what lobbyists typically have to say when they put together these type of policies?
Well, I think the first thing to understand is when we looked at this and when we analyzed, when we talk about lobbying, essentially what lobbying means is understanding the political decision-making process and then understanding how one can access and influence that and bring arguments to bear. And it happens in most democracies in the world. Now, what has happened in the last year under COVID is that the decision-making process in the UK has actually shifted. So in the past, when we were talking about something akin to the matter that we are bringing to the fore, which is the relationship between the UK and South Africa and travel, the UK would rely a lot on the Foreign Office. They would rely a lot on the opinion of the UK High Commissioner in South Africa. That's totally shifted. It's gone and it's centralized now in about 6 or 7 people clustered around the Prime Minister. So our job is how do we get in and speak to that small coterie of people. And in doing so, we've identified key political players, as I say, across the political divide. We had a very good conversation with Baroness Linda Chalker, who is one of the senior Conservative figures, and she's rallying a whole lot of other people who are sympathetic to our arguments. And bearing in mind, and then we've engaged with one of the senior Labour members of the Transport Committee, and then the senior Lib Dem peer, Lord Johnny Oates, who's the former Chief of Staff to Nick Clegg, has also been hard at work for us. But it's through these connections is that we will be put in touch with other politicians. So one has to sort of almost map the market and one goes about in a logical and systematic way in terms of bringing these arguments to bear. And we've spoken about the science, but the other one that's quite pertinent that we're putting firmly on the table is around conservation. So we have a unique USP here, which is around our wildlife, and that's predicated on this long-standing sort of model that we've developed in which we conserve wildlife areas and we conserve rare species. And that's what the world wants to come and see. The lack of tourism sustains that. If we don't have a tourist flow, those resources become acutely at risk. So it's another argument we're bringing to bear. And then there's obviously the entire, although we're spearheading this from a tourism point of view, it speaks to all matters of economic relation between the two countries, trade and investment, and a whole range of other activities have basically been put on hold.
David Frost, let me thank you for your time. Hopefully your strategy didn't rely much on Matt Hancock for obvious reasons, but let me thank you nonetheless for giving us your take on what your plans are. David Frost is the CEO of the Southern Africa Tourism Services Association. Really appreciate it on the AM Report.